All right. Here is another 10-minute learning with Brandon. I'm your host, Brandon, and we're just going to learn a little bit more about some respiratory diseases. So we're going to talk about interstitial lung disease, which has been one that I've kind of seen come up now and again in my time at the hospital. So let's see if I can get some things moving here. All right. So welcome to our 10-minute learning session today. We're going to be diving into interstitial lung disease, also known as ILD. It's a group of conditions that cause scarring on the lungs and difficulties in breathing. So we're going to explore its causes, symptoms, diagnosis, and treatment options. All right. So what is interstitial lung disease? ILD is an umbrella term encompassing various diseases led to lung scarring or fibrosis. The scarring stiffens the lungs, making it challenging to breathe and supply oxygen to the bloodstream. So unfortunately, lung damage from any kind of ILDs, interstitial lung disease, that come up is typically irreversible and worsens over time. All right, so causes and factors, kind of go over those a little bit. So there's many factors that can increase the risk of ILD, including genetics. That seems to be kind of a common theme, threshold here with all of these lung diseases. Genetics are definitely a big thing. There are certain medications that you take. Usually the ones that I can think of are for heart. Amiodarone is one that helps with your increased heart rate, so it helps lower that. That can be a cause of this disease. Radiation or chemotherapy, exposure to hazardous materials like asbestos. So autoimmune diseases can also wreak havoc on your lungs, such as scardosis or rheumatoid arthritis. They elevate the risk. Smoking not only increases the likelihood of interstitial lung disease, but it exacerbates the condition. If you have it, or if they start getting it because of that, then you continue to smoke, that's going to make things worse. In some cases, the idiopathic pulmonary fibrosis, in some cases, kind of like the idiopathic pulmonary fibrosis, the exact causes are still kind of unknown, but a little linked towards that smoking history. So symptoms and complications. So a lot of people will have shortness of breath. It's often accompanied by a dry cough, chest discomfort, fatigue, occasional weight loss, and a lot of the time by the time these things manifest themselves, significant lung damage has already occurred. So untreated interstitial lung disease can lead to life-threatening complications such as high blood pressure, heart, or respiratory failure. So if you're having any of those kind of symptoms, you really should be going to talk to your doctor, getting some advice, giving them a good history of your symptoms and how you're feeling and what your medical history is, so that they can make a good decision, maybe do some imaging if needs be. We'll get to that point here in a little bit. So just kind of going right off of that, so how you diagnose these interstitial lung diseases. Doctors are going to probably order chest x-rays, kind of see if there's anything there that's causing them to want to get more specific or better imaging. And then that would mean they're going to get a CAT scan of your lungs, your chest, and that's going to help kind of assess your lung condition there. Lung function test, so PF, pulmonary function test, is a way to kind of measure your total lung capacity. And they will also measure your diffusion capacity as well. And what happens with ILD is it'll thicken the lungs in the capillary areas, walls, the alveoli, thicken them to where diffusion of oxygen and CO2 is a lot harder and more difficult. So invasive procedures are going to be the things like a bronchoscopy. So they'll send a camera down into your airway and check your airways, your alveoli. Really, it's not really that, but the alveoli, but more so the airways and the bronchial trees and everything like that. Or they'll do a lung biopsy, cut a piece of your lung tissue out, and then send it off for testing to see what you have. And that'll get you a very specific diagnosis depending on how bad your symptoms are. So your treatment options, there's a few things that can happen. Like we said earlier, they're not reversible, a lot these interstitial lung diseases, pulmonary fibrosis. So treatment for interstitial lung disease varies based on type and severity. While lung damage is often irreversible, treatments focus on symptom relief, improving quality of life, slowing the disease progression down. Medications like corticosteroids reduce the lung inflammation, while oxygen therapy aids breathing and prevents complications. So that's where you have people that are actually on oxygen doing that therapy to help with the diffusion problem that a lot of people that have ILD suffer from. And so getting more oxygen there, higher concentration, will help you actually be able to do things. So pulmonary rehabilitation offers also techniques to be able to enhance lung function and provide emotional support. And so in severe cases, though, and if you're able to qualify for that, they would do a lung transplant as well. The only other, and I'm sure there's other ones, we'll probably get to them, but the only one I can think of off the top of my head would be someone that has cystic fibrosis, which maybe we'll talk about next, which is a very horrible genetic disorder that people, they didn't used to live very long, but nowadays they seem to be living a lot longer. But that's the only other one usually for getting a lung transplant. I've heard of some people that had really severe COVID as well that got lung transplants, but that didn't seem very, very often. All right, so in summary, interstitial lung diseases encompasses various conditions leading to lung scarring and breathing difficulties. So the best thing is early diagnosis and a management of those symptoms and problems that you're experiencing, so to help be able to relieve those symptoms and give you a better quality of life. So for your personalized treatment, you need to really consult your doctor and look for the best case scenarios for you in particular, and start taking those medications to really kind of help slow that progression down. Just to let you know, if you are interested in more information about any kind of lung diseases, respiratory type stuff, I'm going to start getting all my information from the American Lung Association, and that is their website right there. There's a lot of awesome things that are included in that, and there's just a lot of good information. So I'm going to be just borrowing a lot of their information and kind of get things going that way. So I'm trying to make sure that these are a lot more of the 10 minutes instead of the longer ones. And so I'm working on not rambling and giving you the best information possible. So shout out to anybody that's watching and checking out these videos. Hopefully they're educational, and thanks for participating in a 10-minute learning with Brandon. Have a good night.